I want to say, first of all, that on behalf of the 3 pilot sites, that we were grateful to have been part of this flagship project. We worked hard for 4 years with technical partners and among ourselves as pilot sites. We've had terrific experiences, and we are looking forward to the continuation that I know Jose is going to deal with after I have done this presentation. The pilot sites, we've had lots of common experiences in this project, but also we have been working obviously from different circumstances regarding primarily the healthcare systems, but also legal situations and so forth. And that is indicative when I do the presentation regarding the recommendations, the possibilities that the different pilot sites see in adapting some of the results from the project. We start with the Basque Country, the healthcare system there, and this basically is performed. The project has been based in Osa-Pideza public health system, and the major partner in the Basque Country has been Chronic Uni, the Institute for Health Service Research. I just want to say also that I'm going to reinforce lots of the presentations that have been done previously and reflect on them through these different pointers from the pilots, and basically just give examples of some of the comments and the presentations information that has been given previously. In the Basque Country, it is very important, and it's an important strategy to work on to enhance patient-centered and seamless care. And we've been talking about integrated care basically the whole day in different circumstances here, and that you will see in the responses from the pilots as well that focus is on seamless care and integration of care. This contains obviously coordination and continuity of care between different service levels, different caregivers, organizations, and this is within organizations and between organizations that we are focusing on. So strategies again from the Basque countries are totally aligned with the content in C3-Cloud. The one very positive aspect of the project has been that the planning of the care is a forward movement. It is looking into the patient's care from a forward perspective. So it becomes a dynamic situation. And this is relating especially to the complex morbidity, chronicity, elderly patients that we're dealing with in this project. What needs to be developed is further to take it past this testing stage in the project is the development of the interoperability that has been mentioned in different presentations during this day. However, we all feel from the pilot sites that this is a tool, the project, the concept, the solutions that is close to the market. So we're very positive to continuation of our collaboration in this respect. And from the Basque country, it's mentioned that a possibility in regarding using the results in its ecosystems, it's to use the modular exploitation of different components from the C3-Cloud project, and also consultancy services regarding putting the IT level of the Basque country healthcare system on the same level as and enable the C3-Cloud concept to be used in that region. We continue to next picture, please. Thank you. South Warwickshire Health Community, you've heard some about that, and that's an NHS Foundation trust organization. There it is of great importance that the management of patients is not only cost effective, but also obviously on the safest possible level. And to enable this, it's important to have integrated IT systems. And this is where C3-Cloud, with its findings and its basic construction as a project, facilitates an integration between a move, cross-organization, and multidisciplinary care. And this is what is mentioned in all 3 pilot sites, obviously. It's an attractive aspect of the care plan in the project, that it gives a complete summary. It's shared in the ways of two-way engagement between caregivers and the patient. And it's managed, the care is managed in real time, which is also of very important, an important factor. A suggestion from South Warwickshire is that they would like to see a development of the CDS in the form of templates library that obviously then has to be updated and has to be included with new information and so forth. So that's a question how that would take place, but that would be very useful in using the C3-Cloud concept after the project. And they would like to see a introduction into ecosystem of a central repository and a clinical management system that would assist the South Warwickshire health community in the management of patients to do it cost effectively, safely, and patient-centered. We go further to the last pilot site, which is Region Jämtland Härjedalen, where we are placed right now here. What this pilot site is focusing very much on is actually something that was described clearly as an expected impact in the application and thus in the consortium agreement of this project, and that is new model of integrated care delivery. Because a holistic solution is a very important way of solving many of the challenges regarding patient-centered care, resource utilization, etc., etc. And we all know what the challenges are, and we regard integration of care as the one very important solution in this fact, and that is why we think C3-Cloud project is of such interest. And the project has contained many innovative components that you've been hearing the whole day about, different aspects and the way they interact with each other, and that is obviously also very important. We would like to have a full integration of the C3-Cloud concept into our electronic health record system, and that is Cambio Cosmic, that is our provider in that respect. We feel that the C3-Cloud concept has a better target capacity in the EHR situation. What we would like to see as a pilot site is we'd like to roll out the whole solution. We're not interested that much in specific modules or methods. We feel that for integrated care, it needs to have the approach of the whole solution. And we have mentioned that we would be very, very interested to function as a demonstrator for a year or two regarding the rollout of the whole solution. And I know you, Theo, are going to talk about the C3-Cloud Partnership Limited. So I leave that to you. Thank you.
Thank you, Marie, and thank you for your nice presentation and perspective of our 3 pilot sites. I have to, at this point as coordinator, thank the pilot sites for all their efforts during the C3-Cloud exercise. Despite the difficulties sometimes in terms of deployment, I believe that what we have achieved is to have a live system within the healthcare provision, and that is something that I see in very few projects. And the pilot demonstrator and the pilot study we did, the technology trial we did, was with live patients and within the live system. So I think this is something that we are very grateful of our pilot sites.